Before the nearest doctor was a 2-hour ride down a mountain road. Appalachian families kept their own medicine cabinet, and it grew in the garden, the root cellar, and the woods out back. Some of what they relied on has since been picked apart by modern science and found to actually hold up remarkably well. Some of it, honestly, was pure grit and good luck stretched into tradition. We're counting down 12 of the home remedies mountain families swore by for generations, what they actually did, and what we now genuinely know about whether it worked. One quick note before we start. This is history and folklore, not medical advice. Some of what's on this list is genuinely backed by modern research. A few made this list precisely because they're a fascinating and honestly a little terrifying look at what people were willing to try when the nearest doctor was too far away to reach in time. If old mountain know-how is your kind of thing, hit subscribe now. All right, let's get into it. Number 12. Honey on a cut or a burn. Long before hydrogen peroxide showed up on store shelves, a spoonful of raw honey went straight onto wounds and burns to keep them clean while they healed. This is one that modern medicine actually backs up almost completely. Honey is naturally low in moisture and slightly acidic, which makes it a poor environment for bacteria, and it also produces small amounts of hydrogen peroxide naturally as it interacts with the wound. Studies on medical-grade honey have shown it can genuinely help minor wounds and burns heal faster, with less scarring than some conventional dressings. Hospitals actually use medical-grade honey dressings today for exactly this reason. Grandma wasn't guessing on this one. She was decades ahead of the pharmacy aisle. Number 11. Garlic for colds and infections. A clove of raw garlic, crushed and either eaten straight or steeped into a hot tea, was the go-to at the first sign of a cold coming on. Garlic contains a compound called allicin, which research has shown does have real antimicrobial and immune-boosting properties, and several clinical studies suggest regular garlic intake may modestly reduce how often people catch colds and shorten how long symptoms last when they do. It won't cure an infection outright, and raw garlic in large amounts can upset a sensitive stomach, but the underlying instinct behind reaching for it wasn't wrong at all. Number 10. Ginger root for nausea and an upset stomach. Fresh ginger, chewed raw or boiled into a strong tea, was the standard fix for a sour stomach, morning sickness, or a rough wagon ride down the mountain. This is one of the best documented folk remedies out there. Clinical research consistently shows ginger can ease nausea through its effect on the digestive system and possibly the brain's nausea signals, and it's recommended by actual doctors today for exactly that reason, including for pregnancy-related nausea and motion sickness. It's a rare case where the old folks and modern medicine agree completely, down to the mechanism. Number 9. Elderberry syrup for the flu. Come cold and flu season, families would cook down elderberries with sugar or honey into a thick, dark syrup, taken by the spoonful at the first sign of getting sick. Modern research has actually identified real antiviral compounds in elderberry extract, and several clinical trials suggest it may shorten the duration of flu symptoms when taken within the first day or two of getting sick. It's become genuinely popular again in health food stores today, for exactly the reason mountain families already knew a century ago. It seems to actually help, and it tastes a lot better than most medicine. Number 8. Mullein tea for a cough. The tall, fuzzy-leafed mullein plant that grows wild along fence rows and old pastures got steeped into a tea for coughs, congestion, and sore throats, and sometimes the leaves themselves were smoked for lung complaints. It's been used as a respiratory remedy across cultures for centuries, going all the way back to ancient Greek and Native American medicine. While large modern clinical trials are limited, mullein does contain saponins and other compounds with mild anti-inflammatory and expectorant properties, which lines up reasonably well with why generations of mountain families reached for it whenever a cough wouldn't quit. Number 7. Apple cider vinegar for just about everything. A spoonful in a glass of water, sometimes with a little honey stirred in, was used for sore throats, upset stomachs, aching joints, and general run-down feelings. The evidence here is genuinely mixed. There's some decent research suggesting modest benefits for blood sugar control after meals, But most of the sweeping claims about vinegar curing whatever ails you simply don't hold up under real scientific study. Still, a mild diluted vinegar tonic is generally harmless for most people, which is more than can be said for a few remedies still ahead on this list. Number 6. A mustard plaster on the chest. For a bad chest cold, mustard powder got mixed into a paste, spread onto a cloth, and laid across the chest until the skin turned warm and pink. This one genuinely works, just maybe not the way anyone assumed at the time. The mustard oil is a mild skin irritant that draws blood flow to the area, creating a real, physical sensation of warmth and looser breathing, not unlike how modern menthol chest rubs work today by tricking your nerve receptors. The catch is that mustard plasters can also cause a real chemical burn if left on too long or applied too directly, which is exactly why the practice eventually fell out of favor once safer options came along. Number 5. The onion in the sock. A slice of raw onion, tucked into a sock and worn overnight, was believed to draw out fever and pull the sickness down through the feet by morning. This is the first one on the list where the folklore runs well ahead of the science. There's no credible evidence onions absorb toxins through the skin of your feet, and the theory doesn't line up with anything modern medicine understands about how infection or fever actually works. That said, it's completely harmless, cheap, and easy to try, and it's a great example of how families genuinely experienced relief and needed some explanation for it, even when the actual mechanism had nothing at all to do with the onion. Number 4. Sassafras root tea as a spring tonic. Every spring, families dug sassafras root right out of the ground and brewed it into a fragrant, reddish tea, believed to thin the blood and clean the body out after a long winter. Here's the important update. The compound that gives sassafras its distinctive flavor and smell, safrole, was found decades ago to be a carcinogen in animal studies, and the FDA banned it as a food and beverage additive back in 1960 as a result. It's a genuinely beloved mountain tradition, tied to the first warm days of the year, but it's one item on this list that modern science actually recommends leaving firmly in the past, or at least drastically limiting. Number 3. Whiskey and honey for a sore throat. A small hot toddy of whiskey, honey, and lemon was the standard bedtime remedy for a sore throat or a stubborn cough. The honey and lemon genuinely help soothe irritated throat tissue, and warm liquids in general do ease a persistent cough reflex. The whiskey mostly just helped a person relax enough to actually sleep through the discomfort. Modern doctors will tell you plainly that the alcohol itself isn't doing any real healing, and it's not something to give a child, but as a short-term comfort measure for an adult on a bad night, the core idea wasn't far off the mark. Number 2. Turpentine and sugar for parasites. This one needs a real warning label. A few drops of turpentine dripped onto a sugar cube was historically given to children and adults believed to have intestinal worms, and some families even rubbed diluted turpentine on the chest for congestion. Turpentine is genuinely toxic when swallowed, capable of causing serious kidney damage, nervous system effects, and even death in high enough doses, and it has absolutely no legitimate place in home treatment today. It made this list not because it worked, but because it's a stark, sobering reminder of just how far families would go with no doctor for miles around, and a good example of exactly why the old ways deserve real scrutiny rather than blind trust. Number 1. Spider webs on an open wound. Perhaps the most infamous mountain remedy of all, fresh spider web, gathered straight off the barn rafters and packed directly onto a bleeding cut. There's a surprisingly thin thread of real science buried in this one. Spider silk does contain a protein related to vitamin K, which plays a genuine role in blood clotting, and some modern lab research has actually looked into silk's antimicrobial potential for future wound care. But packing an open wound with whatever happened to be hanging in a barn also came with a very real risk of introducing bacteria, dirt, and even tetanus spores straight into the bloodstream. It's exactly the kind of remedy that reminds you why the phrase "grandma's medicine cabinet" comes with a pretty significant asterisk attached. So that's the real mix. A few of these hold up shockingly well under modern research. A few were about as safe as they were useless, and a couple genuinely explain why doctors eventually became easier to reach than a jar of turpentine. That's the whole story of folk medicine in one list. Equal parts hard-earned wisdom and pure desperation. And it's not always easy to tell which is which until someone finally puts it to the test decades later. If your own family has a home remedy that got passed down and never wrote itself into any book, drop it in the comments. Whose was it? And what part of these mountains did it come from? Some of this knowledge is only one generation away from disappearing for good, and it's worth writing down before it goes.